My name is Tiffany Neal. I'm a microbiology student at Vincennes University Jasper campus. Today, we are going to be discussing Legionellosis. If it's untreated, there's a death rate of 40 to 80% in immunosuppressed individuals. If they are treated, there's a 5 to 30% death rate, and overall death rate is 5 to 10%. We will be discussing the history, biology, types, causes, symptoms, transmission, diagnosis, treatment, and community action. Legionellosis was discovered in 1976 at an American Legion convention in Philadelphia. It was known as severe pneumonia. What is Legionella? Legionella is the parasite of Legionellosis. It grows best at a temperature of 35 degrees centigrade. It is a free-living protozoa within biofilms and water systems. It lives intracellularly within macrophages, specifically the vacuoles. It is a rod-shaped bacilli, gram-negative aerobic bacteria. It is often found in contaminated water known as Legionella pneumophila. If it's found in potting soil, it is known as Legionella longvitae. Age, race, pre-existing health conditions are the susceptible groups related to Legionellosis. Most infections do not cause illness, though. It is often found in Black people of low income. The environment, type of job you have, education, healthcare access, and your home living situations are factors. Jobs include construction workers, housekeeping, cleaning. It is acquired by community and travel, such as smoking, drinking, immunosuppression, chronic respiratory and renal illnesses. It's also found in hospitals by surgeries, intubation, since it's going down the respiratory tract, and aspiration. It is transmitted through aerosols from contaminated water, such as air conditioners, heating, and cooling systems. Shower heads, sink faucets, humidifiers, and whirlpool spas are common factors. Aspiration of contaminated water or ice are often found in hospitals or nursing homes. Babies during water births are also susceptible. There is no human-to-human transmission reported. Pontiac fever is the non-pneumonic form of Legionellosis. It is acute flu-like illness lasting 2 to 5 days. It has an incubation period up to 48 hours. The symptoms include fever, chills, headache, malaise, and myalgia. There are no deaths reported with Pontiac fever. Legionnaire's disease is the most common form of Legionellosis. Its incubation period is 2 to 10 days. Up to 16 days have been reported. The first symptoms include fever, loss of appetite, headache, malaise, lethargy, muscle pain, diarrhea, confusion, and mild cough. 1/3 have blood-tinged phlegm or hemoptysis, which is one of the more classic symptoms noted with Legionnaire's disease. It can be anywhere from a mild cough to fatal pneumonia. It leads from progressive pneumonia to respiratory failure and multi-organ failure, resulting in death. Legionnaire's disease is known worldwide, with outbreaks from a 2-mile range. 10 to 15 cases per million are reported annually in Europe, Australia, and the USA. 75 to 80% are 50 years of age or older, and 60 to 70% are males. Death predictability. A delay in diagnosis, the severity of the disease, appropriate antibiotic treatment, environmental concentration, or how virulent the virus is in that location, age, and pre-existing conditions all play a factor in the outcome of someone with this sickness. Diagnostic tests include blood and urine tests, sputum cultures, and washing from the lung. The Dieterle silver stain or Gimenez stain shows filamentous rods in an individual with Legionella bacteria. It does have motility, and it can be seen under an electron microscope as a detailed cell wall, cytoplasmic structures with flagella and pili for movement and adhesion. The first chest x-ray that you see on here is an individual with clear lungs. The second x-ray is an individual with Legionnaire's disease. Treatment includes, for Pontiac fever, no medical intervention is necessary. No vaccine is available for Legionnaire's disease. It must be treated with antibiotics for weeks to months on end. Hydration and oxygen therapy are recommended. Antibiotics that are used for Legionnaire's disease include macrolides and fluoroquinolones, such as azithromycin, levaquin, and moxifloxacin. Alternatives include doxycycline. Macrolides and rifampin are combined for immunocompromised patients, and do not use penicillins or aminoglycosides since they do not penetrate the intracellular compartments where the bacteria reside. For mild cases, it lasts 5 to 7 days. Severe cases can be 10 to 14 days or longer. Always consult a healthcare physician. So for the community action, it's important to have water safety plans. Disseminate aerosols, clean and disinfect, especially water heating, cooling systems, and controlled temperatures such as ice machines within the hospital or nursing homes. Biocides can be used for whirlpool spas or hot tubs, such as chlorine, and reduce stagnation. Continually monitor the water systems. There are community health initiatives in place to prevent contamination of water. The World Health Organization provides resources for cities and individuals needing assistance. In summary, Legionella was founded in 1976 at a USA convention. It is a parasite with an optimum temperature growth at 35 degrees centigrade, and it is a protozoa in water systems. There is Legionella pneumophila, which is in water, and Legionella longiviae in potting soil. Pontiac fever and Legionnaire's disease are the two types of diagnosis for Legionella. It is caused by community, travel, or hospital-acquired diseases. Symptoms include fever, fatigue, organ failure, and death. Diagnostics include blood and urine tests, sputum cultures, chest x-rays, Gimenez stain, and electron microscopy. There are no vaccines available, but Legionnaire's disease is treated with antibiotics such as macrolides and fluoroquinolones. In summary, it is important to have community action and continue to monitor our water systems to prevent legionellosis. Thank you.